Hi, everybody. I'm Merlissa Alfred, and I work with Recovery People, and I just want to welcome you all to this afternoon's webinar, which is Hell Yes for Recovery, Healthcare Reform for Peers in Recovery. This webinar is going to offer a little insight into the healthcare system and what it means for us peers in recovery. So it's an introductory presentation, and we're going to provide just an overview of the healthcare reform in the U.S. and Texas. And we're going to just review some of the changes that have affected access and delivery of healthcare to individuals and families. So by saying Hell Yes for Recovery, we hope that through education and awareness, we do our part to ensure that all Texans have access to quality healthcare. And this webinar has been made possible by This webinar is made possible by a SAMHSA-funded grant that Soberhood received. It's the Brass Tacks Grant, which stands for Bringing Recovery Supports to Scale Technical Assistance Center Strategy Grant. So basically the overall purpose of those grants is to increase awareness and knowledge of health reform among peer-run organizations, and as well as individuals with substance use disorders and mental health conditions. So as I mentioned, Soberhood received that grant, and Soberhood is a nonprofit that provides recovery support, education, and advocacy, and community building. They're administering 3 statewide programs, those being TRON, or Texas Recovery Oriented Housing Network, which is a certifying body of sober homes in the state of Texas. Recovery People, which I mentioned earlier that I work with, and we coordinate peers across organizations, communities, and fellowships, and we really just provide leadership and workforce development for peers in recovery. And then there's also Texans for Recovery and Resilience, which unites youth, adults, and families in mental health and recovery addiction. So I'm Merlissa Alfred. I'll be delivering today's webinar, and there's also Jason Howell, who's the Executive Director for Soberhood, and he's doing the behind the scenes for the webinar, so I'm grateful for that. And also Beth Wilson, who did our media outreach for our healthcare campaign. So the instructions for this webinar, it's going to last approximately 60 minutes. There should be a box labeled questions, and so if you have questions along the way, feel free to submit those questions in that box. The slides for this webinar are also available for you to download in the box that says handouts. And then after this webinar is concluded, we're recording it, so it'll be made available on recoverypeople.org as well as on YouTube. And so by participating in this webinar, we hope that you'll gain just a general understanding of the background and the issues and the process related to healthcare reform. And particularly, we're going to cover the health coverage rates in U.S. and Texas, just provide the basic overview of what is the Affordable Care Act. And then also we're going to go into, so what is health insurance? How do you get it? What does it do for you? Those basic things. And so all of this stems from the Patient Protection and Affordable Care Act that was signed by President Obama in March of 2010. And so that's the national legislation for healthcare reform. And this act hopes to extend insurance to more than 30 million uninsured people, primarily by expanding Medicaid and providing federal subsidies to lower and middle-income American families. And the 30 million uninsured people includes the 6 to 10 million people that have untreated mental illnesses and addictions that can be helped by gaining access to health care. So speaking of substance use and mental health, this graphic illustrates behavioral health issues that affect millions of Americans. So behavioral health refers to both mental illness and substance use, and it can range from mild to severe, temporary to chronic, and are mostly treatable with effective medications and clinical interventions. And so we can see how healthcare is very vital to this population of people. SAMHSA has reported that 39% of people served by state mental health authorities have no access to insurance, and 61% of individuals served by state substance abuse authorities have no insurance. And we all know that untreated mental illness and substance use can affect our quality of life, both in childhood as well as in adulthood. And often individuals with serious mental illness are likely to have other medical conditions and as a result have a shorter life expectancy than individuals without. People historically with mental health and substance use have been subjected to pervasive discrimination in health insurance, and health plans for people with pre-existing mental illnesses, if they even included those benefits, have been historically more expensive. But all that changes with the advent of affordable care and the parity laws, which basically now require health insurers to provide coverage for mental health, behavioral health, and substance use disorders that are comparable to physical health issues. So here's a small snapshot of what's happening in our country. Currently, the national uninsured rate is 13.4%, which is equivalent to 42 million people. And estimates show that 1/5 to 1/3 of these uninsured people also have a mental health or substance use disorder. In Texas, our uninsured rate is 22%, and that is equal to 5.7 million Texans. So in Texas, we hold the nation's highest rate for uninsured people. Most of the uninsured Texans are adults that are low-income workers. So nearly 70% of adults are in working families, and 40% live below the poverty level. And on average, nearly 7 out of 10 uninsured adult Texans are between the ages of 19 and 44. And most uninsured adults in Texas are U.S. citizens. 20% of uninsured adult Texans are undocumented immigrants, which, because of that status, they remain outside of the accessibility to health care. So what happens with all these uninsured people? We have this cycle. So without having access to health care, our immediate health care option is to go to the emergency rooms. And that results in hospitals having higher uncompensated care. So uncompensated care is the health care or services provided by hospitals that don't go reimbursed. They often arise when people don't have insurance and can't afford to pay the cost of care. So in Texas alone, hospitals had to eat $5.5 billion in uncompensated care in 2014. So because of those rates, they try and pass on as much as they can to the customers that do pay or do have insurance. And then they also, that results in higher premiums, and so some people have to drop insurance, or some employees have to drop insurance so they can't afford the premiums, and then that leads to more uninsured people. And so then the cycle continues. Uncompensated costs are usually addressed through property taxes and insured patients, like we mentioned before. So Texas has the second highest health insurance premiums in the country, right behind Florida. So for example, $1,800 of a family's premium each year is attributable to the cost of the uninsured in the state. And Texas has the third highest property taxes in the country, and a portion of that goes to covering uncompensated costs. So this is where the Affordable Care Act comes in. This, as we mentioned, this was healthcare reform that was designed to improve the way Americans receive healthcare and access healthcare, and that was put into place on March 23rd, 2010. So the goal is to make healthcare more affordable, accessible, and higher quality. So, and this definitely includes the previously uninsured Americans and Americans who had insurance that didn't provide adequate coverage. So this legislation basically mandates that each state either create their own healthcare marketplace or participate in the federally facilitated marketplace. It also acts to connect individuals and small employers with affordable healthcare options. So the major provisions went into effect January 1st, 2014, which individually we each had to have some type of health insurance. But significant changes happened before that date and will continue to go on for the next few years. So the goals of the Affordable Care Act is to reduce the nation's number of uninsured Americans, which we previously stated was 42 million people in the United States, 5.7 million in Texas. So by doing this, they hope to expand coverage to these people, and particularly for us, those 6 to 10 million people that have untreated mental illness and addictions. And it definitely wants to address the inflationary cost that healthcare typically undergoes. So as we mentioned, the open enrollment for the health insurance marketplace began October 1st of 2013. And then by 2014, Americans had access to affordable healthcare options. And the marketplace allows us to compare plans, see what we can afford compared to what we need for healthcare coverage. And so the hope is that all the reforms that have taken place through this legislation give millions of people who were previously uninsured coverage. And they're trying to allow this coverage through several provisions in the Act. One is by expanding public programs, which is Medicaid. Unfortunately, Texas did not expand their Medicaid program, but on a national level, states have the option of expanding Medicaid to 138% of the federal poverty level. So for an individual such as myself, it would be $15,600, or for a family of four, it was $32,000. Those families would be eligible for Medicaid under the expanded option. So another provision is the American Health Benefit Exchanges. As we mentioned, those marketplaces where people can go in and compare different plans and see what they need for from themselves and for their families, given their given budget. They've also made changes to private insurance. So they incorporated new regulations that prevent health insurers from denying coverage to people for any reason, including health status, and from charging higher premiums for those based on status or gender. Now there's an individual mandate that we mentioned earlier that requires most individuals to have health insurance beginning in 2014. And then there's also the employer requirement that if they don't offer affordable health coverage, then there are fees that they would have to pay per employee. So how does that affect Texans? This map represents, out of the 5.7 million uninsured Texans, where their eligibility falls given the new health care laws. So like we mentioned before, Texas did not expand Medicaid, so 2% of adults would be eligible for Medicaid, and 12% of children would be eligible for Medicaid, or CHIP, which is the Children's Health Insurance Program. But it was reported that those numbers represent eligibility before the Affordable Care Act, but for whatever reason, they had not enrolled in such programs. In the marketplaces, 28% would be eligible for tax credits or subsidies that would go towards getting affordable health care. 21% would be eligible for either their employer's insurance, or if going through the marketplace would be more affordable, that's an option. They just would not be eligible for tax credits or subsidies. 20% of uninsured Texans are ineligible for assistance because they are uninsured and undocumented immigrants. And so, unfortunately, this group is likely to remain uninsured, although they would still have health insurance needs and health care needs. And then that 17% in the gap. So we mentioned before, Texas has not expanded Medicaid. Had they expanded Medicaid, this group would be eligible for health care through the Medicaid option. However, they don't make enough money to be eligible for the marketplace subsidies, and they make too much to be eligible for Medicaid. So they're just left in the gap without any access to health insurance. So let's look at that a bit further. Texas has not expanded the federal Medicaid option. So the way the Affordable Care Act was written, it was to provide affordable health care through Medicaid expansion for low-income adults in the marketplaces, like we mentioned. However, a Supreme Court decision in 2012 made Medicaid expansion optional, and Texas basically said, hell no, we're not expanding. So now there's more than 1 million Texans in that coverage gap that are living below the poverty level who are ineligible for subsidies as well. Their jobs don't provide insurance, but their income is not high enough to qualify for assistance in the marketplace. So again, Texas has the largest coverage gap in the country. That can change if the Texas legislature, which meets, I believe, again in 2017, if that's discussed or even thought about, that would help millions of people gain access to health coverage. And this chart says that we've left $65.6 billion on the table by not expanding Medicaid, but we've read reports that it's been as much as $100 billion over the next 10 years. that we're just leaving out. So again, there's that coverage gap, people that make too much to qualify for Medicaid, not enough to qualify for the market subsidies. On a national level, that equates to nearly 4 million poor uninsured adults that fall into this coverage gap. So they would have been newly eligible for Medicaid had their state chosen to expand coverage. And so for Texas, a quarter of the people in the coverage gap in that 4 million are right here in Texas. And that's unfortunate because the Affordable Care Act provides a lot of benefits for people, which this chart depicts. And some of those benefits include now parents can leave their children on health insurance plans until they turn 26. And so that's expanded health insurance to more than 3 million people. Insurance companies cannot turn down people who already have medical conditions, which are called pre-existing conditions. Everyone has to be accepted. Insurance companies can no longer cancel people's insurance plans if they get sick, which that's why we need health insurance, is for that health care. Companies can no longer set a limit on how many medical bills they will pay for someone on their insurance plan. Preventative care is now free, and that's one of the major intentions of the Affordable Care Act, is for us to not use health insurance just because we're sick, but for preventative care as well. So the insurances can't charge your doctor for visits for babies, vaccinations, annual checkups, screenings, and other care that helps us stay healthy. Like we mentioned before, we can buy our insurance in the health insurance marketplace. Before, if you didn't have a job to give you health insurance, you had to buy it on your own, and it was very expensive. And now health insurance plans have to cover a certain amount of care, which before was left up to the option of the companies what would be covered and what wouldn't. And so that level of care that must be covered are the essential health benefits, and these are the benefits that plans both in and out of the marketplace have to provide to us customers. So it's intended to be a comprehensive package of items and services, and these essential health benefits are services that will be reimbursed or covered by the new exchanges as well as the newly eligible Medicaid beneficiaries. And so, like this list shows, those benefits are ambulatory patient services, emergency services, maternity and newborn care, mental health and substance use disorder, which is great to see it included as one of the 10 health benefits, hospitalization, preventative wellness services, which we talked about before, lab services, prescription drugs, rehabilitative services, and pediatric services. So again, the law's emphasis is on prevention. Okay, and then we touched on the mental health and substance use disorder. I just wanted to point that out and focus on that for a minute. As we said, they must be covered as part of the benefits package by all insurance policies. And this really builds on, there was a Parity Act in 2008, which said that any mental health benefits covered by insurance has to be on par with physical, like if you need to go have surgery or whatever, see a doctor, those payments or co-payments need to be equivalent. So basically now the ACA is saying that even more so than being equivalent, it has to be offered. Before it didn't have to be offered, but now it does. And those provisions now include that there are no annual limits or higher co-pays for treatment of mental health disorders or substance use. It eliminated the number of visits that used to be different between mental health substance use versus medical surgical benefits. The financial requirements cannot be greater for mental health or substance use benefits. The health plans that give patients the option to go out of network for other services have to do so for mental health and substance use. So there's a whole list of provisions that are now standard as part of health plans offered in the under health reform. And that's really important for us because we mentioned before that of the 30 million people that are anticipated to gain coverage, this will also include those 6 to 10 million people with mental health and substance use disorders that just didn't have access to such treatment. And so the 18 million adults potentially eligible for Medicaid in all 50 states, at least 2.5 million will have substance use disorders. And of the 19 million uninsured adults with slightly higher incomes who are eligible for the marketplaces, an estimated 2.8 will struggle with substance use. So this essential health benefit is really vital to our healthcare needs. And so that is basically an overview of the legislation. And so now I want to go more into just the mechanics of, so what is health insurance and how do we use it and how will it help us? So health insurance is basically the way we pay for our healthcare expenses. As you can imagine, each plan is different, but there's typically an option to cover preventative care like doctor's visits and screenings, as well as hospital visits, ER trips, and prescription drugs. And of course, there's vision and dental options as well, but those might have to purchase separate. Health insurance basically protects us from paying the full cost of medical service when we're injured or sick, and now we have the preventative aspect of it, and so we can make sure that we go in regularly and not wait years between doctor's visits. So it just helps us stay on point with our health. And before we get into any further into health insurance, we're going to hear these terms like, what is a copay, what's a deductible, what's a premium. The copay is just the flat rate we pay when we have to have a medical service. And they vary from time to time, but for an example, for me to have a doctor's visit, I'll pay a flat $35 copay every time I go see the doctor. And the rest is paid by the insurance company. So deductible. A deductible is a fixed amount of money that we pay to our insurance company before their benefits kick in. And typically, the higher the deductible, the lower the premium, and vice versa. And so deductibles are a yearly amount. So if my plan's deductible is $2,000, I'll have to pay $2,000, but for my health insurance, will cover any of my medical costs each year. And then premium. So premium is the amount I pay per month to be covered by an insurance company. So if I work for a company that offers health insurance, they'll pay the bulk of that premium. But again, that will vary based on my situation. And there's other terms like coinsurance or out-of-pocket maximum, in-network, out-of-network. You'll hear those along the way as well, but these are the ones you'll hear all the time. So why do we need health insurance? Like as this chart shows, with insurance, my costs are much lower, and I only pay a portion of it. With insurance, the costs are much higher, and it's all my responsibility to pay. And as we know, healthcare can be very expensive, and most people couldn't afford to pay the high cost of healthcare on their own. So that's where health insurance comes in. We pay that premium every month that we talked about earlier, and the insurance company pays for the other portion. So, for example, instead of paying hundreds of dollars in out-of-pocket costs for a doctor's visit or thousands for a surgery, I pay a less amount based on my health insurance plan. And I need that health insurance so I can stay healthy. Oftentimes the mindset is health insurance is something we need when we're sick, but it's more than that. So we can take advantage of preventative services that health plans now offer. And so I can go visit my doctor more regularly instead of waiting for something to hurt or ache. And even more, I'm learning that more health plans are offering wellness programs at discounts. Like I can use my health insurance to get a discount at the gym or whatever. Those are now included depending on the health plan. So it's important to look at that stuff. So how do I choose a health plan? I have to think, what are the coverage needs of my family and for myself before I really start going too deep into it. So different plans cover different things. Some plans protect against medical costs, but not the more routine services like a checkup at the doctor. These plans are often less expensive than comprehensive plans, and they protect you in the case of medical emergencies, routine visits, and they can even offer flu shots and, like I mentioned before, reimbursement for gym memberships. So when choosing a plan, I need to figure out, so how much can I pay? what are the copay, the deductible, the co-insurance, what is the out-of-pocket maximums, like knowing what my budget is and what I can afford. Some plans charge a higher premium every month while offering lower co-payments, deductibles, and the such. And there are others that charge lower premiums, but they may pay more out-of-pocket when you use your plan at a hospital or doctor's office. And then another factor to consider is whether prescription drugs, vision, and dental coverage are included with that plan. And then is the doctor you want to see in-network or out-of-network? And depending on your plan, out-of-network might cost more than an in-network doctor. If I'm managing a chronic condition, I'll probably want to take into account how often I'll need to see my doctor or my specialist, and which health facility do I want to use. Like, there's all kinds of factors that go into choosing a plan, but really at the end of the day, it's what are your health coverage needs and what is your budget, and then what are the available plans that fit those needs. And there are all types of health plans offered, and this chart lists some of the more common ones. The two I want to point out are the ones you hear often, which is the HMO and the PPO. The HMO stands for Health Maintenance Organization, and with this type of plan, you choose your primary care physician, and that physician coordinates your care through in-network doctors and hospitals. So when visiting a specialist or receiving care, you'll often need a referral from your primary care physician. Oftentimes, you don't have the option to see an out-of-network provider when you're in an HMO. So that's compared to a PPO, which stands for Preferred Provider Organization. So if you want the option to manage your health care instead of your doctor, so that you don't need referrals, then the PPO might be the way to go. And with a PPO, members receive care from any provider, either in-network or out-of-network, and without a referral. So it depends on what your needs are. But as you can see, there are several plans, and this chart is a really good illustration of what the similarities and differences are. So how does health insurance work? This chart gives you a pretty clear example. You pay your premium to your health insurer, you're part of a risk pool, and then you go out and there's, for whatever services you receive, you pay a portion and the health insurance pays a portion. So when you choose your health plan, you're agreeing to pay that premium every month, and in return, your health insurer agrees to pay a portion of your covered medical costs. And so when we join that health plan, we're joining a group of people who also join that group plan. And so the insurers call it a risk pool because they're measuring the amount of risk associated with me and the rest of the people on that plan. Some people are at higher risk because they're not in health and likely to need a lot of medical services, while others are low risk because they're healthy. But we can't forget that there's always unexpected illnesses or injuries that can happen to anyone along the way. So when we need health care, I share that cost with my health insurance company. And the plan outlines what my costs are, my out-of-pocket costs, whether it's a copay, a deductible, or a co-insurance. And as we know, some years I'll be at the doctor all the time, and some years I can go without seeing the doctor. It's an unknown. But if the medical costs are exceptionally high, then the insurance company has the right to adjust those rates from time to time. But under Affordable Care Act, if the insurance rates increase by more than 10%, they have to let us know why it's increasing. So there's several ways that we have access to health insurance under the Affordable Care Act, and this chart gives you a synopsis of those options, and we'll go further into each option that's available. But there's the marketplaces, which you've mentioned, Medicaid, which has been expanded in 28 states and DC so far. Texas has not expanded Medicaid. Employers, which is the largest source of health insurance in this country. It insures about half of the insured people. Parents, and we mentioned that before, can keep their kids on their plan up to age 25 or through age 25. And then Debt Direct Enrollment, where you can buy your insurance either through the marketplace or not. that option is always still available. So let's look at each one. Employer-sponsored coverage. That's the principal source of health insurance in the United States. 55% of people are covered through their employer. On such plans, the employer pays for most of the costs related to health care. You pay a small premium, the company pays the rest. For employer-sponsored coverage, everybody that's an employee has to be offered health coverage whose employment qualifies them for health coverage. So sometimes if you're part-time, you may not qualify, but if you're full-time, then you typically will qualify. And they offer, like we mentioned, already talked about HMO and PPO plans, dental, life, short, long-term disability. So under the Affordable Care Act, it does not require businesses to provide health benefits to their workers. However, large employers face penalties if they don't make affordable coverage available. And some workers may not be covered by their employer's coverage because they're ineligible for benefits, or they elect to receive coverage through their spouse, or they may refuse to get the coverage from their firm if more affordable options are available. And like I said, there are penalties if that company doesn't offer it. Student health plans. Some colleges and universities are offering health plans to their students in addition to what they offer to their faculty and staff. Student health plans can be purchased if there just isn't, I'm sorry, I'm on the wrong one. Let's go back to young adult coverage. Young adult coverage, like we mentioned before, parents can keep their kids on their plan until age 26. And even if the child is married, they don't live at home with their parents, they're attending school, they are not financially dependent, or they can enroll in their employer's plan. It doesn't matter. As long as they're under the age of 26, they can stay on their parents' plan. And like I said earlier, this has helped 3 million young adults gain coverage under the Affordable Care Act. There it is. I'm sorry, I skipped the student health plan. Basically, you can get health insurance through your student, through your university or college if it's available. So it would be helpful to find out if that's an option if you're a student. Okay, Medicare. Medicare is health insurance for these age groups, or these groups: people who are 65 and over, people who have kidney failure or long-term kidney disease, or people who are permanently disabled and cannot work. So it's a federally administered health insurance plan, and there are different parts. There's parts A, B, C, and D, depending on your needs. Part A typically covers hospital insurance. Part B covers medical insurance. Part C is a private plan that pretty much offers the hospital and medical insurance. And Part D covers drug coverage. And it's more detailed, but that's the basics of Medicare. It is not part of the health insurance marketplace, so you don't have to replace your Medicare coverage through the marketplace. To apply for Medicare, you just visit your Social Security office. And then there's Medicaid. So Medicaid helps provide health care for people with limited income and resources. And it's for people who low-income people who fall into these groups: pregnant women, children under the age of 19, which is the Medicaid chip, people 65 and over, people blind, people disabled, or people who need nursing home care. And it pays for a large portion of health coverage for millions of people. So Medicaid is a program run jointly through the federal and state programs. So all 50 states participate in Medicaid, but participation is optional. And some states administer their own Medicaid programs, some don't. So like we mentioned before, Texas has an expanded Medicaid. And as of January 1st, 2015, those states that did expand Medicaid, they expanded their income eligibility to 138% of the federal poverty level, which we said before. And now some states cover all adults below a certain level. So to apply for Medicaid, you can go through the marketplace, or you can just find your local office. So in addition to Medicaid, there's the Children's Health Insurance Program, and that provides health coverage to children, either through Medicaid expansion CHIPs or through separate CHIP programs. And it covers all of these services for kids, so dentist, eye exam, doctor, hospital care. So it's basically a no cost through Medicaid or low cost through a separate CHIP program for eligible children. It provides coverage so that children can get the routine checkups, immunizations, and dental care they need to keep them healthy. More than 8.1 million children enrolled in CHIP as of 2014. It's administered by the states, but jointly funded by the federal government and states. And there are 3 ways they can basically create these programs. One is through Medicaid expansion, which would be free to those who receive that care or that plan. The target is low-income children under the age of 18 whose families have little to no money. The family pays nothing to children's Medicaid. And then there's also the option to create a separate CHIP program under which the state receives funding to provide children's health assistance to uninsured low-income children, children aged 18 and younger. It's basically for children and families that can't get Medicaid and can't afford health insurance. And the families pay $50 or less per year to receive those benefits. And then states have the option of doing a combination program, which is the Medicaid expansion CHIP, as well as just a separate CHIP program. And so now we have the health insurance marketplace, which was created under the Affordable Care Act. And so under the marketplaces, this is where people go to find out information about their health insurance options and also purchase health care insurance. And you can also determine your eligibility for Medicaid and CHIP in the health insurance marketplace as well. So to utilize the marketplace, you have to be a U.S. citizen, you cannot be incarcerated, and you have to live in the United States. If you have, like we said before, if you have Medicare coverage, you're not eligible to use the marketplace to buy a health or dental plan. And to date, 26 states have defaulted to the federally facilitated marketplace, Texas included. So the federal government administers that marketplace, the state does not. So if you don't have coverage through your job or Medicare, Medicaid, or CHIP, or another source, the marketplace helps you find and enroll in a plan that fits your budget and meets your needs, like we talked about before. And most people who apply actually qualify for those premium tax credits that lower the cost of coverage. And some also qualify for savings on deductibles, co-payments, and other costs. And just like I said, you can check your eligibility for Medicaid and CHIP in the marketplace, and you can do that any time of the year. There's no limited enrollment for those programs. However, for the regular health insurance plans, there's an enrollment period, and that's typically November through January of each year. So this chart just gives you a little guesstimation of what you would qualify for given your income. So if I make $20,000 and I just go down this chart, and I'm a single individual, I might qualify for lower premiums in the marketplace based on my income. I might qualify for lower premiums and lower out-of-pocket costs for my marketplace insurance. I do not qualify for Medicaid because we did not expand, and so I don't qualify for anything related to Medicaid as a single individual with no kids, not pregnant. So everybody's situation is different, so this chart is a good place to just see what your options might be based on your family status and your income. Okay, so for the marketplace coverage, there's 4 ways that we can get access to healthcare, or ways we can apply to find out what our options are. I can apply by phone, and a customer service representative will help me fill out the application and review my eligibility results. And if it's during open enrollment period, then I can get coverage right away. I can apply online if I have access to a computer and internet. And the website is just healthcare.gov. And online, I can create my account, fill out an application, see what my eligibility is. Do I qualify for Medicaid? Do I qualify for subsidies? I can figure all that stuff out on my own if I feel I'm able through the website. If I need help and want somebody to help me walk through this, because it can be a little confusing, it's a lot of information, I can get somebody to help me, like sit live with me and help me figure all this stuff out. And so I can work with an assister or a navigator who will sit with me and help me fill out the paperwork either online or on a paper application. And they'll review my results with me and tell me what I am eligible for, what I can enroll in. They'll help me pick a plan that's right for my needs, for my family, and they'll help me actually enroll based on my budget. Or I can always apply by mail. I can fill out the paper application and mail it in. And then I will also, in turn, get my results by mail. Once I get those results, I can choose to call to finish my enrollment process, or if I gain access to a computer with internet access, I can go online, create my Marketplace account, and just finish the enrollment process. But the Marketplace isn't the only place to get coverage or the other options that we discussed. You can still look for health insurance on your own outside of the Marketplace. Under the Affordable Care Act, they're intended to be similar. However, the only difference is if you want to see if you qualify for subsidies or tax credits, you have to go through the Marketplace. Those are not available outside of the Marketplace. So this tells you ways you can apply for health insurance outside of the Marketplace. So you can directly call up an insurance company and see what plans are available in your area. And those insurance companies typically have websites that will let you compare the plans that they sell. Or you can contact an online health insurance seller. These services offer health plans from a number of different companies, and again, you can compare prices and features and then enroll with the one that suits your needs. Or you can contact an insurance agent or broker. Agents generally work for a single health insurance company, while brokers generally sell plans from a number of companies. They can help you compare plans based on the features, the prices, and they can help you complete your enrollment. You do not pay more by using an agent or broker. They're generally paid by the insurance company whose plans they sell. So there are various options for us to get health insurance. And then, so next steps is gather your information, gather data, and get covered. No matter how you apply, you can complete a single application and find out what you qualify for. There's health plans with premium tax credits and other savings based on your income. There's free or low-cost coverage through Medicaid and CHIP. And the next enrollment period for health insurance is November 1st, 2015 to January 31st, 2016. If you don't have health coverage, you may still be able to enroll in 2015 coverage under a special enrollment period. Or if you're eligible for Medicaid and CHIP, you can enroll in that at any time during the year. Those special enrollment periods for 2015 would be if you had a life change, like you got married, or you had a baby, or you lost other coverage. That would qualify you to get coverage for the remainder of 2015. So yeah, just continue to gather information and see what you qualify for, what your needs are, what your budget is, and then also share your story with us. Like if you had health insurance that helped you in your recovery, we want to know that. If you didn't have access to health insurance and that affected your recovery, we want to know that as well. So you can always email me. My information is on the next slide, and we'll use that hashtag HellYesForRecovery. So as a community, we can continue to advocate for affordable health care for everybody. And so that's it. Just I don't know if anyone had questions or comments, but if you didn't feel comfortable leaving questions or comments on that questions box, you can always email one of us, and we'll be happy to help you with whatever you need and figure out stuff that you might need. So that's all I got. Jason, were there any questions?
No, we don't have any questions. I can unmute everybody to see if they would rather ask questions aloud. Well, it doesn't look like that's giving me that functionality.
Well, I just want to thank everybody for taking the time to listen to this webinar. You could have done anything during this hour, or actually 45 minutes. And so I just want to thank you for taking time to find out more about what our healthcare options are and how, as people in recovery, having access to affordable healthcare is so important to our continued recovery efforts. So I encourage you to please contact one of us if you have questions or if you want to find out more information about anything we talked about, or if there's anything that wasn't covered that you'd like to hear about. We can definitely gather that information and work on another webinar in this healthcare series. So again, thank you so much for your time.
Melissa, we've got one question from Sierra. Hey, Sierra. She's
Okay.
asking Twitter, Facebook, what's the best platform for the hashtag?
Both. Anywhere you can hashtag something, hashtag it there. We've been doing a lot on, Beth has been doing a lot of postings using that hashtag on both Twitter and Facebook. So we appreciate both places.
Our Facebook page is facebook.com/recovery people. Our Twitter is recovery peeps. And we're also wanting to explore maybe doing videos through Google Hangouts. So if you would like to share your story of how health insurance has either supported you in your recovery or the been a barrier, or the lack of health insurance been a barrier, definitely contact us. We would love to record that.
Absolutely. Thank you, Sierra, for that question.
It doesn't look like we have any other questions, so I'll do a final plug before signing off. Um, we're going to have this presentation live at the Recovery Capital Conference, which will be held in Austin, Texas, September 26th and 27th. So if you would like to join us there, you can go to recoverycapitalconference.org. Thanks, everybody.
Thank you.